On three. 1, 2, 3. All right. One, two, three. A couple people I want to recognize at the very beginning here. Mike Boyle, Douglas County Commissioner, is with us today. Thank you for coming, Mike, very much. And Father Stephen Bays, in particular, I want to recognize, National Executive Director for 12 years here at Boys Town, and thank you especially for your support and guidance for this project very much. I also want to recognize the donors who have made this possible. The donor wall is right behind over here, and we want to thank them for their continuing to support our efforts to address these behavioral health issues in our community. They were involved in the construction of the first residential treatment center, which is this wing over here on this side, and I'll explain that in just a second, but be sure and stop by and take a look at the donor wall, and if you see those people, be sure and thank them for their donations. Well, this event marks a significant milestone in our constant effort to improve the care of children and adolescents in need of behavioral health services in our community. In 1996, we opened the first Boys Town Residential Treatment Center, which was a 20-bed facility on our downtown Boys Town National Research Hospital campus, and it was established to take care of children and youth with serious behavioral mental health disorders in a safe and secure environment. Over the years, the downtown facility expanded to its present capacity of caring for 46 youth at that location. And then in 2013, our program expanded, and we opened the new residential treatment center facility here that was a 34-bed facility, which is immediately to my left. So with the construction of the new 46-bed wing, we'll now be able to relocate the residential treatment center program from our downtown facility to a brand new facility, and we'll be able to serve a total of 80 children and adolescents in one program on this site. In our constant effort to improve the care of children and adolescents, we also launched a new research effort in 2013, the Center for Neurobehavioral Research in Children and Adolescents. In our attempt to better understand the underlying neurobiological issues associated with behavioral disorders, Dr. James Blair, previously with the National Institute of Mental Health, joined us with his research team to seek better treatment interventions for the kids in our care and make a difference nationally. And I'd like to recognize one of our researchers here with us this morning, Dr. Harma Meffert, who joined us as well from NIMH. I'd also like to recognize some key partners who were the people that made this dream a reality. First, I would like to introduce a member of our hospital staff, Roger Ernst, and he is standing right over there by the donor wall. He is our owner's representative in this project, absolutely key. Roger's been with us many years. He has built many of these buildings, I think all of these buildings actually that are on this campus that you see here, and a very, very key member of our staff. Also, John Andrews is here from the Daly Company, Leo Daly Company, our architect, and we've worked with the Leo Daly Company on many of these buildings as well, I think all of these buildings on this campus here, and provided all of our architectural design, and of course the Hawkins Construction Company. The team that actually was on site with this was Bob Blakely, Jerry Sire, and Scott Mosier, and we want to thank the Hawkins Construction Company. I know Kim is here as well, and thank you very much for your partnership with us. Great team, and I hope that you can take satisfaction in your role, not only in building a beautiful building and a very functional building, but also in saving children and healing families. Thank you so much for your hard work.
Good morning, and thank you for coming today. 20 plus years ago, when the concept of residential treatment centers was first being developed in this country, Boys Town was one of the very first to develop a program. Actually, it was the first to develop it in Nebraska. We don't often take credit for that. No one envisioned that this program would become what it is today. It was an alternative to inpatient and psychiatric hospitals, both short-term and long-term. I would like to share just a couple of statistics that I think really kind of focuses on how this program has developed over the years. In the last 20 plus years, we have served over 4,000 youth and over 500,000 patient days. These youth and families have come from 37 states and 7 different countries. We believe that we were the first residential treatment center in this country to form a program and an environment specifically for children under the age of 10. We are especially proud of our current and past staff. These child psychiatrists, therapists, teachers, nurses, and behavioral health technicians and support staff come to work every day with a single focus: to help our children and adolescents get better. We are especially proud and grateful for the staff's dedication, perseverance, and ongoing hard work to make this program what it is today. We'd like to thank Dennis Fulmer, RTC Director, Peg Reed, Program Administrator, Signe Pettit, Behavioral Health Services Manager, for their contributions to this project. I would like now to introduce Dr. Spellman, our Behavioral Health Medical Director.
I see a lot of familiar faces here from over the years. My girls are here too. I'd like to thank Father Bays and the Board of Trustees for putting their stamp of approval on this project. Father, you've been great about always supporting the things that we do, and I appreciate it. I'd also like to thank Father Peter and remember Dr. Brookhauser, because these were the 2 men that helped lay the foundation for all of this over 20 years ago. I'd like to thank John and Pat, whose strategic vision has made this happen. When we opened the building and had the grand opening 3.5 years ago, I joked with John, so John, are we going to do this again soon? And in John's dry way, he said, yeah, talk to me in about 10 years. And so here we are in 3.5 years, and that's not too bad. I'd also like to thank our staff, as Pat did, the administrators, the therapists, the nurses, and especially our frontline staff, our behavioral health techs. We, as an organization, we try to treat our employees well, but sometimes our kids don't believe in that workplace philosophy, and our techs take the brunt of that. But they look past that current behavior, and they're able to see, the goal of the end product that gets to move on from here. And we've come a long way since those humble beginnings in the Ronald McDonald House. It's been a wonderful trip. And I'm really excited that those kids are going to be moving next week and become part of the village of Boys Town and the Boys Town family. I think it's going to be great. We work with some really troubled children here at the RTC, and the stories are really sad at times. They have severe emotional and behavioral problems, and many have a significant history of abuse and neglect. This building will become their home for a few months, and I'm really happy to see that we can accommodate things with this beautiful light and open, airy feeling, and the colors and the safety features, and this fantastic playground out back. I really believe that with the sophisticated design and the sensitivity to the needs of kids, this facility will become the paragon of treatment centers around the country. Many of our kids are on multiple psychiatric meds, and with the structure and consistency we provide, we're able to greatly reduce and get many of our kids off of psychiatric medications, and I think that's a bonus too. Our little kids unit, the children's unit for ages 5 to 12, is only one of a few in the country, and it tends to go against the standard thinking that kids belong in homes, and we agree with that. But these are kids that have been in multiple foster homes. They've been greatly disrupting their own family's home, and they do need a period where we can help stabilize them and get them back into that family type setting. And our children's unit is safe and comforting. We have a enriching classroom and a fantastic, wonderful teacher. I don't know if she's here today, but just fantastic. We help these little ones learn better self-control and get them back into a family type setting. In regards to education, our children and adolescents enter the RTC on average 2 grade levels below their peers. They often have significant truancy issues, learning disabilities, and have never experienced success in that classroom setting or that academic setting. Our modern classroom space, along with our motivational programming, enables them to excel in the academic setting, often for the first time. In closing, I wanted to say that in doing the day in and day out work of working with these helping troubled kids, sometimes we briefly stop and reflect on the individual lives that we're dealing with, and it's really hard to think about. Some of these stories can be really horrific, and it's really the terrible start in life that these kids really is not fair. But we put our heads down and we get back to work because we know that we too are part of this mission and this work must continue. Thank you.
Many people don't know that Boys Town has a research hospital. And if they do, they wonder, what does that have to do with Boys Town? Well, from the very beginning, 100 years ago, Father Flanagan was a man of science. Also a man of faith, but a man of science. 100 years ago, when he was running a shelter for homeless men, he did 3-year longitudinal analysis of his effect. He discovered he was having no effect. They were getting worse every day. And then the first street kids started showing up. And he did a longitudinal analysis and realized every day they got better. And that's why he decided to make it his life's work. We continue that research here at our hospital and in our youth care programs. We're committed to research and science as we are committed to the faith of our kids. We believe in Father Flanagan's dream that there are no bad boys. There's bad environment, bad training, bad example. When you take a kid out of a tough environment, bring them to a place like this, their behaviors change because the people around them are different and they respond differently to their problems. They're stabilized here and they can be helped, as well as on home campus. Father Flanagan not only believed there were no bad boys, he proved it. With his research, he proved that in the long run, he could turn the most troubled kids into some of the best citizens. That's what we celebrate today, 100 years of research, of faith, and of service to America's most troubled youth. Happy birthday, Boys Town. This is a great new building to celebrate with on our 100th anniversary.